Welcome back. It's now time to go in depth. With just 2 weeks to go before a smoking ban becomes effective in Jamaica, there are many questions about the new regulations. Now on the phone to discuss them is Chief Medical Officer Dr. Michael Coombs. Welcome, Dr. Coombs.
Thank you. Thanks for having me.
Okay, so first of all, smokers say they have a right as adults to choose to smoke. So why ban something that is legal, in your opinion?
Okay, it's all a matter of health. The evidence has grown over the past several decades about the harmful effect of smoking tobacco in so many ways, not just on persons, the health of persons who actually smoke, but on those who are in their vicinity and who actually experience the smoke that is involved when they partake of tobacco use, the so-called secondhand smoke. So obviously, when one considers the fact that the leading cause of preventable death globally is tobacco, then the question that we have to ask ourselves, is there a moral responsibility or obligation of any government to protect its citizens, especially when we consider the number of deaths, as I said, which are preventable caused by tobacco?
So is secondhand smoke really that much of a concern? Is it as bad as people have been making it out to seem?
It is. There are numerous research papers that have demonstrated beyond the shadow of a doubt that the same toxic substances that affect smokers themselves affect persons who are exposed to the smoke coming from the cigarettes or the exhaled smoke from the smokers. This smoke still has quite a number of toxic substances, including what we call carcinogens, cancer-causing drugs. So yes, it does.
But wouldn't it be more so for persons who, say, live with a smoker than the occasional person who happens to be standing next to somebody who's smoking?
No, it can have, and it does have effect on persons who just happen to be in the vicinity of a smoker, not necessarily living with a smoker. Of course, yeah, the person who lives with a smoker who is more frequently exposed, then they are at a higher risk. But definitely persons who are in the vicinity of smokers, they too are affected. And that is essentially the rationale behind this major public health move being carried out not just by Jamaica, I should add, but internationally.
Now, the specific regulations haven't been published yet or haven't been gazetted yet. Can you tell us a bit about what these regulations are and who's affected?
Well, they should be gazetted. They're in the process of being gazetted as we speak. And essentially, the tobacco regulations of 2013 essentially lays out the places where smoking is banned and the penalties that are, will result from those who are in breach. We have our legal officers, and we're in the process of sensitizing those who will be enforcing the regulations. But essentially, that's what the regulations are about, stipulating, where it is banned, the penalty for breach, and so on.
So it's not a complete ban. Smoking is not basically outlawed then?
No, it's not a complete ban. Thank you for that question. It is not a complete ban. It is not illegal. It is really a partial ban, really, in terms of the certain public places and spaces, as I said, in a clear attempt based on solid and compelling evidence to protect our citizens.
But if smoking is as bad as you and other studies suggest, why not just ban it altogether? Why not criminalize it like other drugs, like marijuana, for example?
Well, that is not the intent at the moment. One has to understand that these things, they have a process, and it was not considered. I can't speak completely for the thoughts behind those who, crafted the regulations. But it's a process, and it was deemed prudent at this time to take it in stages rather than in one scoop do a complete ban. I think that really would pose, some serious challenges, and we didn't want persons to be suddenly faced with no opportunities at all, and we felt that it was more prudent, as I said, to do it on a phased basis.
You say in stages and a phased basis, so you do perhaps see this leading to a complete ban in the future?
Well, I wouldn't want to confirm that. No, that's the minister's decision.
Right.
But as I said, it was felt at this time that we would simply look at public spaces and places.
But would you personally want to see it end up there?
Well, with the evidence that exists, personally, for me, I would not have a problem with a complete ban. Not because I'd like to infringe on I think the rights and freedoms of individuals, need to be infringed upon, but simply because the evidence is so overwhelming that there can only be a positive result from not smoking, and it has been demonstrated in countries where the ban is even more widespread. The research has confirmed that deaths from certain chronic diseases, cancers, cardiovascular disease has fallen significantly.
Oh, the one we hear of the most is lung cancer, but there are other diseases also affiliated with smoking, right?
Absolutely. Smoking can affect almost any organ in the body. And in fact, substances in tobacco, the smoking, has been linked to at least 11 cancers, not just lung cancer. You can have cancer of the pancreas, the kidney, the mouth, the bladder, the stomach, and it goes on, even leukemia. So it's most commonly associated with lung cancer, but the substances have been linked to many other cancers.
So how does this impact the health system?
Precisely. Well, right now the world, including Jamaica, is grappling with what we call the non-communicable diseases. And it's now the global epidemic that the health systems are challenged by. In Jamaica here, it costs us roughly $170 million US annually to treat these chronic diseases. And when one thinks of the fact that amongst the risk factors, tobacco is among the highest, then clearly it makes sense that if we can prevent a significant number of these chronic diseases, which currently contribute to 60% of the deaths in our country, then clearly that will reduce the burden on our health services. And so even from an economic standpoint, it's not just a matter of what income is lost or whatever by those who are involved, but it's a savings from reduction in the cost that it costs the country to care for persons who develop these serious chronic conditions. They're not just talking financial costs, you're talking about social costs.
Mm-hmm. Now, we've been talking about this ban on smoking, and of course we're talking about smoking nicotine products, so cigarettes, etc. But there's also another widely smoked drug, an illegal one, that's marijuana. There's been a push in some Caribbean countries to actually decriminalize small portions of marijuana for personal use. Do you think that would work here in Jamaica?
Well, I wouldn't want to comment too much on the situation concerning marijuana. It is still illegal, and as our Minister of Health, Dr. Ferguson, said the other day in response to a very similar question, that our focus at the moment is not on marijuana. We're now dealing with the whole issue of the tobacco. So that's the most I'd perhaps say at this time.
What about alcohol and its impact on the health system as well and related diseases?
Well, let's be very clear. We are concerned with every substance, every risk factor that affects a person's health adversely. This is not a matter of just singling out a risk factor such as tobacco and just focused on that and neglecting the other substances. No, we certainly are concerned, and we have programs currently that seek to reduce the impact of even alcohol, which is well known also to cause problems with the health of our individuals. However, just to mention very quickly some stats just to put things a little bit in perspective, there are some stats out of the Centers for Disease Control and Prevention that states very clearly that in terms of the number of deaths, for example, from HIV, suicide, the abuse of alcohol, motor vehicle accidents, and murders, deaths from all of that combined are less than the deaths that tobacco is linked with.
Wow.
Just to give you the perspective, but we definitely are also concerned about substances such as alcohol and the abuse of them.
Yeah. Well, I want to thank you for joining us, Dr. Coombs.
No problem.
Very interesting statistics there. Dr. Michael Coombs, Jamaica's Chief Medical Officer at the Ministry of Health. That's it for In Depth. Stay tuned after the break. It's time for sports.